Health officials in Ottawa are providing an update on recommendations in the wake of COVID-19 with an emphasis on long-term symptoms. Let's listen in.
Genetic sequencing data on SARS-CoV-2 viruses show continuing increase in immune-evasive variants, notably BQ1 and BQ1.1, while the previously dominant BA5 lineage variants are declining. With the increased prominence of these variants in Canada, at a minimum, we could see a slower decline and a higher plateau in the number of infections, as well as hospital admissions in Canada, as this respiratory virus season plays out. In terms of the other respiratory viruses circulating, RSV activity has leveled off nationally, and infections are declining in some jurisdictions. This means activity levels are now within the expected range for this time of year. In contrast, influenza is continuing to trend well above expected levels for this time of the year, but this varies across the regions. Most worrisome is the increase in influenza-related hospitalizations. The IMPACT network, which provides data on pediatric hospitalizations due to influenza, has noticed sharp increases in multiple sites across the country. These data also suggest a shift to a higher proportion of hospitalized cases occurring in the 10 to 16-year age group compared to seasons prior to the pandemic. However, the highest cumulative hospitalization rates for influenza continue to be among children under 5 years of age. Currently, the weekly number of pediatric hospitalizations being reported is above levels typically seen at the peak of the influenza season. Tragically, due to this high number of pediatric cases, we're also seeing higher than usual number of ICU admissions and deaths due to influenza in children. Le plus préoccupant est toutefois l'augmentation des...
The most concerning is the increase in hospitalizations linked to the flu. The IMPACT network, which provides data on pediatric hospitalizations due to influenza, has noted sharp increases in multiple sites across the country. These data also suggest a shift to a higher proportion of hospitalized cases occurring in the 10 to 16-year-old age group, compared to the seasons prior to the COVID-19 pandemic. However, the highest cumulative hospitalization rates for influenza continue to be among children under 5 years of age. Currently, the weekly number of pediatric hospitalizations being reported is above levels typically seen at the peak of the influenza season. Tragically, due to this high number of pediatric cases, we are also seeing a higher than usual number of ICU admissions and deaths due to influenza in children.
Indicate that this year's influenza vaccine is a good match to circulating strains and therefore is likely to help protect against serious influenza disease. Influenza vaccine takes about 2 weeks to provide optimal protection. So as we rapidly approach the holidays, now is the time to get vaccinated if you have not already done so. Flu shots are available across Canada and can be given to adults, teenagers, and children as young as 6 months of age. The flu shot can also be given at the same time as the COVID-19 vaccines. There are now more options for COVID-19 booster doses for children 5 to 11 years of age, and the recent approval of a bivalent vaccine for this age group. If it has been 6 months or more since your last COVID-19 vaccine dose or COVID-19 infection, getting vaccinated now will boost your level of protection going into the holiday season. Staying up to date with the recommended vaccines provides an important foundation of protection. The results of the first population-based survey of adults across Canada, conducted between April and August of this year, show that close to 15% of those with a confirmed or suspected COVID-19 infection experience longer-term symptoms or post-COVID condition, with almost half of these individuals experiencing symptoms for a year or longer. While ongoing studies are needed, there is emerging evidence that the risk of developing post-COVID-19 condition is reduced if you have received 2 or more doses of COVID-19 vaccine prior to infection. As we move indoors and gather to celebrate the holiday season, I encourage you to build on the foundation that vaccines provide by taking additional personal protective measures. Together, these measures can provide very good protection against COVID-19 as well as other respiratory infections. When planning a holiday gathering, consider the potential impact of respiratory illnesses on your health and social plans, the health status and risk factors of the people you're gathering with, and the places you'll be gathering in. Properly wearing a well-fitted, well-constructed face mask in indoor public spaces or crowded settings, and taking steps to take the best ventilation possible are layers of protection that can reduce everyone's risk. Lorsque vous prévoyez un rassemblement pour le temps de fête,
When planning a holiday gathering, consider the potential impact of respiratory illnesses on your health and social plans, the health status and risk factors of people you're gathering with, and the places you'll be gathering in. Properly wearing a well-fitted and well-constructed face mask in indoor public spaces or crowded settings, and taking steps to get the best ventilation possible are layers of protection that can reduce everyone's risk.
Continue to be challenged by the additional burden of all respiratory viruses this time of year. The impact, particularly on children's hospitals, has already been overwhelming in many parts of the country. This holiday season, let's do the best we can to make our wishes for health and happiness come true by taking actions to protect ourselves and others from respiratory viruses. Happy holidays, joyeuses fêtes. Thank you, merci, miigwech.
Thank you. We'll start with questions in the room with 1 question and 1 follow. And our first question will go to Laura Osman from the Canadian Press.
Hey there. My first question is for the minister. I wanted to jump off of what you were saying about the government's willingness to increase the Canada Health Transfer, and if I'm hearing you correctly, also explore more tailored bilateral agreements with the provinces. I spoke to Adrian Dix last night, who said that he's still not clear exactly what the government is looking for in order to get those negotiations moving forward. So I'm hoping that you can kind of pull the curtain back a little bit, explain to us exactly how these negotiations work and what conditions you've put to the province and kind of a timeline for getting those talks moving.
Thank you, and I will gladly do so, taking the curtains back, as you say. And that brings me back to the last year, during which we had 12 meetings at the health minister's level, obviously many more meetings between officials and many others. And during those 12 meetings, with the leadership of Minister Dix in particular, and the leadership of other provincial health ministers, we made very serious and good progress on 2 big pieces. The first one was how to support healthcare workers, to retain them better, to recruit them, to recognize their credentials, to train them, and then on data. And because data saves lives, how we can have in Canada a modern health data system that provides data to healthcare providers, to nurses, doctors, specialist physicians, pharmacists, so that the data on people's health are available when these people end up in an emergency department, or they visit their physician, or they go to visit a pharmacist. So how do we make sure that that data supports their health and the work of workers? We were going to the Vancouver conference with great hopes that not only would we finally agree on all of that great work that Minister Dix and others had done, but also we would share that work publicly. Unfortunately, just a few days earlier, my health ministers received an order by their premiers not to speak about those results publicly. And that's an unfortunate thing, because before we come to the means that we need to achieve some ends, we need to agree on the ends and to speak publicly about them and the results that come from investing in workers and supporting patients. So where we are now is we're continuing our conversation. I've met all my health ministers. I've been speaking to them almost weekly in various ways, and we know we'll get to an agreement on outcomes at some point. But we need more work. And we need premiers to let us do that work.
Based on my conversation with Minister Dix, he was under the impression that he doesn't know what the federal government wants. And they might be willing to give it if they knew what the federal government was looking for. Is the ball in their court to come to you, or is it up to you to tell them exactly what criteria you're looking for?
The ball is in the premier's court. At the health minister's level, we all agree. We've got a great relationship. We agree on the diagnostic. We agree on the problems and the solutions to those problems. We were in total agreement in Vancouver in private. The problem is that the premiers don't want us to speak about those outcomes and those results. They want to maintain a futile fight on dollars. And that's a futile fight because they ask for 35%. If you do the calculations correctly, we're already at 35%. If you do what premiers ask us to do, if you add the whole package, the cash transfers and the transfers that come with the tax points, we are at 35, roughly speaking. We were a bit above 35 during COVID-19, which we're roughly at 35 now, and we've been at 35% for the last 50 years almost. Now, in addition to CHT, the tax points, as we all know, we have been investing, and we keep investing in the fight against COVID-19, $72 billion in total, plus all of the additional transfers for home care, mental health care, and long-term care, not even mentioning the $2 billion additional that we sent a few weeks ago to reduce backlogs in surgeries and diagnostics. So on the dollars, it's not a useful fight. If we were to only focus on 35%, we wouldn't do anything more. But the Prime Minister did commit that we would be investing even more in terms of resources. But we need to agree publicly and to speak publicly on the results based on the hard work that Minister Dix and many others did in the last year.
Next question by Valerie Bain from Radio-Canada.
Earlier today, the leader of the Bloc Québécois accused the Liberal Party of taking patients hostage with regards to the healthcare transfers, given that there is still no agreement. The discussions are stalled, that provinces have needs, you have resources, and you're not unblocking them. My answer is that if we're talking about financial resources, the Canadian government is already doing a lot, and even much more than what the provinces are asking for. The 35% that the premiers are talking about, we're already there. If you do the calculations correctly, if you do the sum of transfers, of cash transfers, there's a Canada Healthcare transfer and transfers through the tax points. We're a little bit over 35%. If we add to that the $72 billion that continues to help provinces and territories fight against COVID-19, bilateral agreements, investments in home care, long-term care, and mental health. If you add the $72 billion that will be asked to try to reduce the surgery backlog, there are huge sums of money and much more than what the federal government generally sends to the provinces and territories. In March, the Canada Health transfer will go up another 10%. So this is not a correct discussion to be having. The right discussion is what are the results that we want to reach together. The good news is that all the ministers of health, including myself, agree. In private, we agree on what needs to be done in order to improve and even transform our healthcare system, to have better access to family doctors, to recruit and retain and to train more healthcare workers, and to recognize the skills of foreign-trained healthcare workers so that they can work here in Canada, to reduce the surgical backlog Right now, there is a lot of harm being done in the country. And we need also a modern data system. We don't have a modern data system. We have a mediocre data collection system. And unfortunately, this leads to loss of life and quality of care that is not always sufficient. When healthcare workers are unable to exchange information among themselves, in 2022, faxes and pieces of paper are still being used in order to transfer information on people's health. We are not meeting the needs of modern-day Canada. We can do better.
We've been listening to federal health officials providing an update in Ottawa, talking about some of the recommendations in the wake of COVID-19, but also a significant uptick in influenza among young people.